In general, there are two major issues that children will have with their tonsils, and they may not be related. Some kids may have recurrent throat infections, and we think of this as frequent episodes of strep throat or recurrent tonsillitis. The most common reason that children are referred for evaluating their tonsils is because enlarged tonsils or enlarged adenoids can cause snoring, and snoring can lead to a condition called sleep-disordered breathing. If you feel that your child snores heavily or doesn't seem to get a good night's sleep, is restless when they're sleeping, tossing and turning, trying to find a comfortable position, gasping for air or choking at night when they're sleeping, waking up very groggy and tired, falling asleep during the day too easily, they may benefit from an evaluation for possible sleep apnea. Recent data has shown that children who have sleep apnea in fact have a higher risk of having attention deficit disorder, bedwetting, behavioral issues in school, and cognitive development problems. So we know that your child not getting a good night's sleep can really impact and impair their daytime behaviors. The operation itself typically only takes about 30 minutes. Depending on your child's age and other medical conditions, your child may stay overnight after surgery, but many children can have the surgery and go home and recover at home. The surgery is performed through the mouth and nose. There are no visible incisions on the outside, and from the outside you will never know if someone had their tonsils out. I counsel parents to be aware that after surgery, the recovery may take 2 weeks, and those 2 weeks can be very unpleasant. Children will often experience pain with severe sore throat. They may experience fevers. They may experience congestion. They may continue to snore for a few weeks because they have swelling in the back of their throat. But over 10 to 14 days, as they heal from the surgery, the pain, the fevers, the swelling, and the terrible bad breath that goes with the surgery will all resolve. Most children will come back for one follow-up visit to examine and evaluate the throat, make sure that everything has healed up well, and ensure that their symptoms have improved. Our biggest concern is that there is a small risk of having bleeding in the post-operative period, and bleeding can be very potentially serious. It's a big surgery, and even though it's short, the recovery is long and it's a serious operation. And I tell parents, look at your calendar, mark 14 days from the day after surgery, and just tell yourself, we've got to get through these 14 days and it's going to be okay. And if you have questions about the recovery, give your pediatric ear, nose, and throat surgeon a call, and they're going to talk you through it afterwards.